Good morning and thank you for the opportunity. We are from SGD. Before we'll present our student project called A Study Review of Seroprevalence of SARS-CoV-2 Antibodies in Bali Province. Indonesia shows under detection of COVID-19 cases by routine surveillance. These are the SGD before members. First, I will explain the background. Before that, let me introduce myself. My name is Jennifer Natalie, with last three digit of student number is 101. The article that will be discussed in this study is seroprevalence of SARS-CoV-2 antibodies in Bali Province. Indonesia shows under detection of COVID-19 cases by routine surveillance. That is published in 2022. From the introduction part, we know that the first reports of coronavirus disease of 2019 or COVID-19 came from Jakarta on March 2, 2020, and Bali followed shortly after. In 2020, case numbers rose overall, particularly in Bali, where inadequate testings led to predictions of underreporting. As no seroprevalence surveys had been conducted in Bali, repeating this cross-sectional study was essential to improve surveillance and public health efforts. This article shows how seroprevalence studies are vital for understanding exposure and also guiding health initiatives. And the objectives of this study is to understand determinants of COVID-19 infection in Bali province. Second is to understand natural history of COVID-19 infection. Third is to understand relevance of COVID-19 to occupational diseases. And fourth is to understand number type calculation and interpretation in this journal. Fifth is to understand sampling technique, inclusion or exclusion criteria and study design. Six is to understand data analysis and presentation. Seven, to understand bias in the study. 8. To understand potential outbreaks and steps in outbreak investigation. 9 is to understand surveillance system for COVID-19 infection. 10 is to understand screening method for COVID-19 infection. And 11 is to understand relevance of this journal to disease prevention and control efforts in the community. Next is the benefits of this study. For the public community, this article introduced the public to the general overview and increased public awareness about COVID-19 infections. It also adding sources of knowledge about the COVID-19 infection and also as a learning material and increasing literacy, thereby enhancing their medical knowledge of this subject matter for the students. Maybe that's all for me. Thank you.
My name is Dewi Putra Sakarajasari continue with the last three digits of the number 188, and I will continue the presentation with determinants of COVID-19 infection in Bali province. So the wheel model of health determinants categorize the determinant factors into internal and external factors, while the internal factors include biological aspects and individual behavior. From the biological aspects, the study showed that very young individuals had lower seroprevalence, while males and females showed similar level of seroprevalence. And from the individual behavior, personal health behaviors significantly impact health, such as symptom reporting, and those who reported symptoms were more likely to be seroprevalence or COVID-19 antibodies present. The external factors encompass to social environment, physical environment, and biological environment. From the social environment, the study showed no significant difference in seroprevalence between urban and rural areas due to extensive population mixing. From the physical environment, high-density environments could facilitate the spread of infectious diseases like COVID-19. From the biological environment, ecosystem degradation, like deforestation, can increase the risk of zoonotic spillover. Climate change can influence the spread of infectious diseases like COVID-19 in several ways. Changes in temperature and humidity can affect virus survival and transmission rates. For instance, higher temperatures and humidity levels can reduce the stability of some viruses on surfaces. Climate change can also lead to changes in human behavior, such as increased indoor gatherings during extreme weather, which can facilitate virus transmission. Additionally, climate change can disrupt ecosystems, potentially increasing human-wildfire interactions and the risks of zoonotic diseases.
Hello everyone, my name is Natania Catherine Studio with realized digit of number 175, and this is the natural history of COVID-19. This start from the susceptibility infection. There are a few factors that affect the vulnerability to COVID-19, including environment, age, gender, profession, and underlying health conditions. Research indicates that older adults, particularly over 75 years old, and individuals with compromised immune system are at higher risk for severe disease outcome. Gender disparity has also been noted, with male representing with higher portion of reported cases. SARS-CoV-2 primarily spread through respiratory droplet during close contact between individuals. Uh, Asymptomatic and pre-symptomatic carriers can transmit the virus, complicating effort to control outbreaks. The incubation period for COVID-19 typically ranges from 2 to 14 days, with a median about 5 to 6 days. During this time, individual may not show symptoms but can still be infectious. Once symptoms appear, they can range from mild respiratory issue to severe pneumonia. Common symptoms include fever, cough, fatigue, and loss of taste or smell. In the absence of medical intervention, many individuals may experience individual recovery after the symptomatic phase. The duration of recovery varies widely. Some may recover within weeks, while others may experience prolonged symptom or complication known as long COVID. The study conducted in Bali highlighted significant underdetection of COVID-19 cases through routine surveillance method. This underreporting reflects the challenge in identifying asymptomatic infection and emphasizes the importance of seroprevalence studies in understanding the true extent of COVID infection within communities. That's all from me. Thank you very much.
Hello, my name is Marta, and my last digit of student number is 064. Now I will discuss about the task number 3. So the disease or case discussed in this journal is not directly related to occupational disease. This journal focuses on the prevalence of SARS-CoV-2 antibodies in the province of Bali, which is related to COVID-19 virus infections and how the virus spread in the general population. However, COVID-19 can be related to occupational disease, especially in the context of several factors. First, workplace exposure. Workers in healthcare, public services, and industries that involve a direct interaction with the public have a higher risk of exposure to the SARS-CoV-2 virus. Infections resulting from this exposure can be considered occupational disease. Second, working condition. Crowded work environment, poor ventilation, and inadequate health protocols can increase the risk of COVID-19 transmission. Infected workers may experience short or long-term symptoms, which can also affect their ability to work. Third, company obligations. Companies are expected to protect their workers' health by implementing preventive measures such as mask usage, social distancing, and vaccination. Failure to protect workers may result in legal action related to health and safety at work. And the last is mental health aspects. The psychological impact of the pandemic, such as stress, anxiety, increased workloads, and post-traumatic stress, can also be considered part of occupational disease. So overall, while COVID-19 is a viral infection, exposure and infection in the workplace can make it relevant in the context of occupational health and safety. So that's all from me. Thank you.
Thank you for the opportunity. My name is Gideon Saputra with last digit number 1, and I would like to answer the 4 questions. Based on our journal, there are 6 number types. The first one is sample size calculations, which is the minimum required sample size that was calculated to estimate the seroprevalence of SARS-CoV-2 in Bali province. The calculation using the Lemaitre formula, where it calculates expected prevalence using desired effect, response rate, desired confidence level, and margin of error. The implementation of the results is the calculated sample size of 1,555 in urban Denpasars and 1,158 in rural areas. Ensure that the estimated seroprevalence has a margin of error of 2% with a confidence level of 95%. The second number type is number of households and participants, which is the number of households expected to be visited in its survey. And after calculating, the average expected number of persons per household is 3.46 in Denpasar and 3.89 in non-Denpasar areas. The total sample size is 2,693 individuals, and the implementations is the total number of households expected to be visited is 743, where 450 is in urban and 290 in rural areas, ensuring that the required sample size is achieved. The third number type is prevalence of SARS-CoV-2 antibodies, which is the overall prevalence of SARS-CoV-2 antibodies in Bali province. The calculations divided by 2, which is the weighted prevalence calculated using weighted data to account for sampling designs, response rate, and stratification, and unweighted prevalence calculated using unweighted data for comparisons. The implementation of the result is the weighted prevalence of SARS-CoV-2 antibodies in Bali province was 16.73%, indicating that approximately 16.73% of the population had been infected by late 2020. The fourth number type is the acceptance rate of household and respondents. The acceptance rates of household and respondents in the survey is calculated using acceptance rates. It is calculated as the number of household and respondents who agreed to participate divided by the total number of household and respondents approach. The implementation of the result is the acceptance rates was likely higher in rural areas than in urban areas and higher in round 2 than in round 1, indicating better cooperation from the population in the second round of the survey. The fifth number type is quality control failures, which is the percentage of samples that failed quality control for the laboratory assessed. The percentage of samples failing is calculated as the number of samples that failed quality control divided by the total number of samples collected. The implementations is the results only 1.8% of samples failed quality control in round 1 and only 1.1% in round 2, indicating high quality of the collected samples. The sixth and last number type is seroprevalence by demographic parameters, which is the seroprevalence of SARS-CoV-2 antibodies by socio-demographic parameters such as age, gender, and symptoms. The calculations of seroprevalence is calculated as the number of individuals with antibodies divided by the total number of individuals in each demographic group. The implementation of the results is the seroprevalence was similar across different age groups and genders, except for lower seroprevalence in the very young individuals reporting symptoms in the past 6 months. They were about twice as likely to be seropositive as those not reporting for symptoms. Thank you.
Good morning, doctor. My name is Joseph Ngesibe with the NIM 250. So I'll be discussing is the study design use, sampling technique, or inclusion or exclusion criteria a good design. So for sampling technique, it is not a reliable technique as it requires large scale of testing and it is very time consuming and expensive and is also unsafe for healthcare workers. Inclusion or exclusion criteria will be a better study design than sampling as it has a higher eligibility, able to produce reliable results and can be carried out repeatedly. That's all from me. Thank you.
Good morning, my name is Christine Edgar. I'm last digit of student number 8045. Next, I'll explain the sampling technique, inclusion or exclusion criteria, and study design. This study appears to use a cross-sectional design which is appropriate for estimating the seroprevalence of antibodies in a specific population at a given time. This study also used a two-stage systematic random sampling strategy. This technique will enhance the representative of the findings. Random sampling helps ensure that different segments of the population are adequately represented, minimizing the selection bias. Appropriate inclusion and exclusion criteria were crucial for this validity of study. The study included selected households who were above 1 year of age who were eligible if informed consent was obtained by either the participant or the guardian or parents. However, the study required questionnaire for its data collection, making toddlers included as part of the sample not suitable for the study. The study design can significantly contribute to addressing health problems in several ways. First is identify under detection by demonstrating the gap between seroprevalence and reported case. Results also can guide local health authorities in developing more effective surveillance strategies, improving testing protocols, and implementing public health intervention. And last, insight into the population immunity levels can help inform vaccination strategies and public health messaging. That's all from me. Next will be explained by my colleague.
My name is Stella Angelin Isbianto, and my last three digit of student ID number are 142. And now I will explain the answer of task number 6. So the data analysis and presentations are appropriate because it aligns with epidemiological standards and the findings are consistent with other literature on COVID-19 underreporting. And the statistical analysis used in the study includes estimating seroprevalence through random sampling and adjusting for design effects, which adhere to established epidemiological practices. And the sample size based on estimated antibody prevalence rates with adjustment made for clustering effects and response rates, which ensures that the study has adequate power to detect differences in seroprevalence between urban and rural populations. And the final samples is statistically significant, which provides a strong foundation for the analysis. And moreover, the calculation of confidence intervals for seroprevalence estimates strengthens the validity of the findings. And the presentation of the results, which includes the use of graphs and confidence intervals, add clarity and effective to communicate public health implication. And the clear presentation of seroprevalence data using comparison with officially reported case is essential for identifying discrepancies between actual and reported infection rates.
Hello, my name is Aurelita Minaptriagianto with the last three digit of my student number is 081 and I will explain about the bias in the study. The study on SARS-CoV-2 antibody seroprevalence in Bali province identifies several potential biases that may affect its finding. One concern is recall bias, as participants were asked to report symptoms over a 6-month period, which may have led to underreporting, particularly for mild or asymptomatic cases. Another issue is the low response rate for blood sample collection, especially among younger participants with good seroprevalence estimates if non-responders differ from responders. There is also the potential for sampling bias due to the multi-stage cluster random sampling method, which might have caused clustering or infection within certain household or areas, though this appeared to be minimal. Lastly, selection bias might have occurred due to higher participation rates from rural areas and female participants, affecting the representativeness of the sample. Despite these biases, the study offers important insights into the underdetection of COVID-19 in Bali. That's all from me. Thank you.
Hello, my name is Joshua, my last number 205, and now I'm gonna answer for task number 8, potential outbreaks and step in outbreak investigation. So potential outbreaks can be identified through collecting data samples from questionnaire, interviews, blood sampling, and processing. A range of estimates expressed as a percentage is computed to estimate the population value, with the population mean falling between an upper and lower interval. The prevalence was determined using socio-demographic factors, the present or absent or reported symptoms, and data from both urban and rural areas. The results of the data sample may show a low or high prevalence of SARS-CoV-2 within an area. And the World Health Organization has made some initial steps that general practitioners need to take in relation to potential outbreaks. First is detect and confirm the outbreak and agent. Second is rapid response team. Third is define cases. Fourth is identify case and obtain information. Fifth is descriptive epidemiological investigation, time, place, and person. Sixth is additional studies, environmental risk assessment, and laboratory. 7 is interview cases and generate hypotheses. 8 is evaluate the hypothesis. 9 is inform risk manager and implement control measures. And 10 is communicate findings, make recommendation, and evaluate the outbreak response. Thank you.
Okay, so greetings. My name is Abel Manuel Sianipar with the last digit of student number 118. Now I'll be explaining about the surveillance system for COVID-19 infections. So, in my opinion, to enhance the effectiveness of COVID-19 surveillance in Bali, it is crucial to expand the testing capabilities and improve contact tracing efforts. Increasing number of tests, particularly in community settings, would allow for the identification and of asymptomatic cases, providing a more comprehensive understanding of the virus spread. Additionally, strengthening contact tracing protocols will ensure all potential exposures are effectively monitored, reducing further transmission risk. Regular zero prevalence surveys can inform the public health strategies, enabling the targeted interventions in areas with higher infection rates, which is essential for managing the public health and in a tourism dependent region like Bali. By implementing these strategies, authorities can safeguard the health of residents and visitors alike. That's all from me. Thank you.
My name is Nipular Mayuda with last digit number 083. Screening method for COVID-19 infection. The method for COVID-19 detection in the study described in the journal involving a surgical test to detect SARS-CoV-2 antibodies in the blood. This method allowed for detection of past exposure to the SARS-CoV-2 virus by identifying the presence of antibodies in the blood sample collected from the participant. Another method for COVID-19 screening are RT-PCR, rapid antigen test, and LAMP.
Greetings, doctors and friends. My name is Munifasus Alvin with last digit of the number 137. In this question, I want to explain about the relevance of this journal to disease prevention and control efforts in the community. First of all, it optimizes resources use. It improves efficiency in distributing personal protective equipment or PPE, healthcare staff, and facilities. The second one is true infection rate. It reveals actual COVID-19 spread, helping assess the pandemic scope. The third one is targeted interventions, which is guides focused testing, vaccination, and resource allocation in high-risk areas. Next one is supports vaccination strategies to identify population needing priority for vaccination. The second one is community engagement. It highlights Bali locals communities in implementing effective culturally appropriate health measures. And of course, the last one is future resilience, establish immunity baseline for better, if there's any, the outbreaks of the pandemic in the next year. Thank you.
Good morning, Doctor. My name is Joseph Ngesiwe, the NIE 250 again. For this time, I'll be presenting the conclusion of this student project. So for this student project, it's important for us to understand COVID-19 in Bali and the study, sampling technique, and analysis that can be carried out and done so that any more potential outbreaks can be curbed and treated fast. It is also important to carry out surveillance for the infection so that it does not spread further. That's all from me. Thank you.